Okay guys, this is going to be a quick video on some things that will be useful for your safe dosage calculations worksheet. Not all of the information or methods that you're going to need to know for that worksheet will be in this video, but I thought I'd just throw something up quick to get you moving if you're stuck on one or two parts. So I wanted to go over some quick unit stuff because this can sometimes be confusing if you're not used to doing a whole lot of conversions. Units describe different characteristics. If you're describing mass or how much weight is in a substance, you're going to use milligrams or kilograms usually if you're in the clinic. Milligrams are usually used for medications and kilograms are usually used for patient's weight. You might also have pounds in your clinic, but this worksheet mostly uses kilograms. Most volumes in this packet I think are going to be using milliliters. You'll be using that for calculating volumes of syrups or injected medications or suspensions that you're going to be giving to patients. When you're talking about time, we're mostly going to be talking about how often or how much time goes between dosages. So those can be measured in like a day, like once a day or every 6 hours or something like that. And then there's those combo units that can be a little bit confusing. Concentration is a description of how much of a certain drug is in a given volume of a medication. So basically think like how much sugar is in your coffee. Is there 1 milligram of sugar per 1 milliliter of coffee? Or is there like 0.1 milligrams of sugar in 1 milliliter of coffee? And then we're talking about dosages, or when we're calculating safe dosages, you're going to see this a lot. That's milligrams of the drug per kilograms of the patient's body. It describes how much medication is safe to give to a person based on their weight. And down here we have some common abbreviations that you'll see in the packet. PO means per oral, just means by mouth. PRN means pro re nata, which I think like translates loosely to as the need arises. But when you're reading it, you can just kind of think of it as needed. When you see Q and then some numbers and an H or whatever, that Q just means every. So Q dot 6 to 8 hours means oh, that was my cuckoo clock. Okay. Q 6 to 8 hours means just every 6 to 8 hours. This can get a little bit confusing when you're trying to calculate a daily dose versus a single dose. So let's say you are giving the medication once a day. You're giving that medication once every 24 hours, and so you might write it as Q24H. If your problem says that you are giving the medication twice a day, you want to make sure that you're using the recommended dosage that's expressed in units that use your Q12 hours. So recommended dose might look something like 15 milligrams per kilogram of patient body per, I don't know, Q 6 hours or something like that. It'll come in that order. Okie doke. If you're trying to calculate what the unit should be looking like, if you have the words, look at how many times a day you are taking that medication. And then you're going to divide 24 hours by that number. So if you're taking a medication twice a day, you divide 24 hours by 2, and you get 12. So you write it as Q12H. Okay, what is a safe dose? I'm going to make a little graph here. And I am sorry that I am a little bit tired and out of it. So hopefully I'm making sense. So this axis is going to be dose. Over here will be a small dose. maybe 0. And then over here we'll talk about maximum 100 milligrams. That'll be more. And then on the y-axis we'll have effect on patient. So let's get a little color in here. This yellow band right here is where the medication is going to be having an effect on the patient that we want to happen, and it is not going to be harming the patient. As we give the patient more medication, we're going to start to get into the danger zone where you're going to be overdosing your patient, and you'll get like side effects and badness and stuff like that. And then if you don't give the patient enough medication, then you'll not have an effect. So we will write, these are safe doses, and these are too small of doses. These are too big. Unsafe. And small doses can also be unsafe if you're trying to give somebody a drug that's going to save their life. Like if you're trying to give somebody insulin and you don't give enough insulin, that's dangerous. So we have a line. This isn't going to be like terribly realistic, but let's just say it's a straight line. A lot of times it's like, curvy and stuff like that. But we'll just say it's straight. As we increase the amount of medication we give the patient, so we got 0 here maybe, 50 here, 25. So right when we hit about 25 milligrams, because doses are measured in milligrams, we start to see the kind of effects that we want the patient to have. And then we can keep increasing that dose, and we'll keep seeing those effects that we want to see in that patient. And the side effects will either be minimal or acceptable, considering what the medication is doing for the patient. So that's about 25 milligrams, let's say. And we'll say this is about 50. So if we start to give a patient more than 50 milligrams, we're going to get in the red where we have bad reactions. And that's an unsafe dose. So let's say if I were to give a patient 75 milligrams, that would be unsafe. So basically, this zone is where you want to be in. This dose, 25 milligrams, is called your minimum recommended dose. And this will be your maximum recommended dose. And then all these, anything greater than your minimum dose will be safe, and anything less than your maximum dose would be safe, but it has to be between these. So if you give a patient 10 milligrams, it won't work. If you give a patient, oopsie, not 75, it should be to 50, because this is badness. If I give a patient 75 milligrams, I'm giving them an unsafe dose. So yeah, I hope that made sense. Let's go over a quick little example on just how to calculate a safe dose. Disclaimer, I did not get this from a medication label, so I don't know if any of these numbers would make any kind of sense in the real world, but we're going to pretend they do. So when you look at these problems, when you read the order, try to read the order in English. So right here we have a bunch of like medical jargon, abbreviation stuff. So let's break this up. Benadryl 500 milligrams POQ6H. That would mean I got Benadryl. So give Benadryl. Give them 500 milligrams. And then remember, PO means by mouth. And then Q means every. And then 6H means 6 hours. So the phrase would be, give Benadryl 500 milligrams by mouth every 6 hours. And if we want to write that a different way, for 4 times a day. Okay, that was a blooper. I don't remember. I don't know how I'm going to cut this later, but we can write every 6 hours as 4 times a day as well, because if you take 24 hours and divide that by 4 times a day, days are going to cancel out, and you'll have 24 divided by 4 equals 6. So that's 6 hours between doses. I'm just going over that a couple times because that can be a little confusing. I've had some people struggle with the wording in these problems a little bit, but okay, sorry. I know I said this would be quick and it's not, but okay. So it's important to note that the units need to be consistent throughout the entire problem. It's asking for the child's weight in kilograms, so we're going to go look at the recommended child's dose and make sure that it also says kilograms here when it's talking about the child's weight. If this said pounds, I would have to go and convert that, either using Google Converter or doing the calculations myself if I knew the conversion. But luckily, it's the same dose here, so we just write 35 kilograms. And then to get the recommended single dose for this child, you can kind of figure out what math you need to do for a certain problem by looking at the units that you have here. So here we have milligrams per 6 hours. So you can write that as milligrams per 6 hours. And here you have kilograms. And then for the recommended dose, you have milligrams per kilograms per 6 hours. And it's good that both of them have denominators of 6 hours. I'm going to write that out because it looks a little weird. So, to get the recommended dose, you take the recommended dose ratio there and multiply it by the child's weight. And that's going to equal your single dose. So the units are going to be milligrams per kilogram per 6 hours times kilograms equals milligrams per 6 hours. If you're having issues figuring out what units are going to cancel out, you can also write it as, so if I write this whole thing out, let's see, what's the recommended ratio? 20, okay. So 20 milligrams per kg, and that's multiplies by 6 hours. So basically, in a unit that has these 3 slashes, these 3 units, or two slashes and 3 units, everything after the first slash is going to be on the bottom. So it would look like this. And then when you times it by the child's weight, which is 35 kilograms, there's just an invisible 1 right there, because if you divide anything by 1, it's just itself. So anything, if 1 unit is on the top and the bottom, then they cancel out, like that. So then you are left with milligrams per 6 hours, which is perfect because that's what we want our solution to be. So, whoops, that's supposed to be 20. It's 20 milligrams per kilogram per 6 hours times 35 kilograms, and that is, oh, calculator. That would be our answer for a single dose. And that's the recommended. So that is the maximum that you can give that person. The order is for 400. So in order for, the order is safe if the ordered amount is less than the recommended dose. the recommended dose needs to be larger. And in this case, the ordered dose is 500 milligrams per 6 hours, which we have up here. And that is less than 700 milligrams per 6 hours. So yes, this one would be safe. But let's say our calculations came out and the recommended dose was 400 milligrams. Then that would not be the case. This would be unsafe because the ordered dose, 500, is larger than 400. So that means that the doctor wants to give the patient more than what is recommended, and you can't do that. Now it's going to be a little bit different if you have a range here, so we'll go over that in our next one. I'm going to cut this video here because it's long, and you got a human only has so much attention span. So, all right, see you guys in a minute.